translocation 414 has been historically considered high risk, but if you look at all patients, you can see that there is a high variability even within translocated 414 patients. And you can say that approximately 30 to 40% of these patients are truly high risk. How can you identify them? So one way is to look at T414 plus another high-risk cytogenetic abnormalities. One of the most frequent combination is the combination with 1q copy number alterations, so 1q gain or amplification. So the other thing that can be used to dissect this apparently homogeneous group of patients is to look at the site disruption of the NSD2 gene. So in the 414 patients, there is a disruption of NSD2, and if this disruption occurs late in the gene, your prognosis is going to be worse.